Welcome, everybody. My name is Ellen Solaris. I'm one of the two membership and communication co-chairs here at the Minnesota Public Health Association. And I'm going to just kick off this presentation today. You are here for a presentation about the Statewide Health Improvement Partnership, which we are excited to have you joining us for. Just a few Zoom reminders. Please mute your microphone when you're not talking. We are recording this presentation, so we want to avoid any background noise. It's up to you if you want your camera on or not. Again, we are recording, and this presentation we will have available for people to watch. If you feel comfortable, please rename yourself to include your pronouns. And some of you may have hopped on after I said this, but if you want to introduce yourself in the chat and say where you're coming from, that would be really exciting and interesting because we're talking about public health work that's really across the state and rooted in communities. We'll have you put questions and comments in the chat, and we'll be monitoring those throughout. There will be time at the end for those. I am going to take a moment to read our ancestral land statement, which was created by our Health Equity Committee and community partners. We use this at all of our MPHA gatherings, and you can read more about it and find access to it on our website if you're interested. All right. We ask you to take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and Anishinaabe. Indigenous people have a long-standing history and connection to the land since time immemorial and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and United States governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors and descendants, as well as the land itself. I am so glad to be in this space with you all today, all 73 of us, which is really exciting. I think we all are acutely aware of the questioning and attacks on public health that are happening across the country. And a wonderful thing about MPHA is we know how much we all need each other, how we need the belonging and support and mutual learning from each other, because we need to know what, public health is doing, what it looks like, what the impact is in all of the, beautiful ways that public health exists, to be able to speak to the value. And we're here for that, and we're here to support folks. This is the part where you'll know I'm a membership co-chair. MPHA needs you. We need folks to join us as members, to show up on committees, to provide, the ideas and the power and the vision to keep us moving forward. And so I want to encourage folks to join as a member. We have lots of folks who are joining us that have not joined as members. Maybe this is your first time here, maybe not. But we want to encourage folks to join as members and engage. And so at the end of today's presentation, we'll share that we have a discount code for folks to join as a member. An individual membership is just $5 a month. And we are scrappy. So you might think that doesn't, sound like too much money, but it goes such a long way for MPHA and what we're able to do, especially in this moment. So with that, I am going to pass the mic over to my colleague and just guide and mentor, I would say, Shirley Sherry, who's going to lead this presentation today, talk about the Statewide Health Improvement Partnership. All right, Shirley, I'll stop sharing.
Okay. And then I'm going to work to share. I hope this is the one. Can everybody see it? And I'll put it in presentation mode in a sec.
I can't see it.
Okay, just a sec here. How about clicking on share?
Yep, it's right. I can see it.
Okay, now I just need to find my cursor and put it in presentation mode. How about that? And it keeps disappearing on me. So, do you see it down here? Okay. I am going to stop sharing for a sec. I'm going to put it in presentation mode because I don't know why the cursor wasn't going where it needed to go. That's really weird.
Would you like me or your eye to share the presentation?
I've got it here now. Now I just need um to share it, and let's see here. I'm not sure why it's. Do you see it now?
Nope.
Mm.
Maybe it's a multiple
It's probably a
screens.
multiple screen thing. We should have practiced this beforehand.
Okay,
Notice
someone
how,
said in the chat, and I 1000% agree. It is just us, so no worries.
oh, yeah, no, I
Like,
know. It's a little irritating because I had it and the cursor just wouldn't go to it. So that's really weird. Do you see it now?
yes, but it's not in presentation mode.
How about that?
Yep.
Do you
Yeah,
see
looks
the
great.
notes?
No.
No.
Nope.
Okay, wonderful. Wow, that took 5 minutes. Sorry about that. Um, my name is Shirley Sherry, and I am the Population Health Systems Manager for our Office of Statewide Health Improvement Initiatives. We fondly call it OSHI. And OSHI has been in existence for just about 15 years. SHIP has been in existence maybe a year before OSHI was created. Um, I've been with the program since about 2012-ish. Just to let you know, I have a little bit of history with the program. And so I want to talk about the Statewide Health Improvement Partnership. I have a few slides on that, but then also I'll move it on to our speakers because it's the wonderful work that they're doing. And I noticed when people were coming on to the chat that we also have a lot of our colleagues as well. So thank you. It's just us, right? Um, so SHIP, the Statewide Health Improvement Partnership, it's an MDH initiative aimed at enhancing community health by promoting active living, healthy eating, commercial tobacco control, free living, and mental well-being. It was established in 2008 as part of a bipartisan health reform law, and SHIP collaborates with local and tribal public health organizations across all 87 counties and 10 tribal nations in Minnesota. So SHIP focuses on sustainable, community-driven solutions. You're going to hear a lot, community-driven, to prevent chronic diseases such as cancer, heart disease, stroke, type 2 diabetes, all of the risk factors that contribute to these diseases. And we do this by supporting policy systems and environmental changes. And SHIP works to create healthy environments where Minnesotans live, work, learn, and play. And you hear this tagline throughout public health on the national level as well. We have over almost 3,000 collaborative partnerships when we count them all up throughout the state. And we have over 850 engaged community leaders. When we talk about the PSC work, this is really an upstream prevention public health approach. And so by embedding health promoting policies, and that's health in all policies, reshaping systems and transforming environments, our SHIP the public health practitioners ensure that healthier choices become the default and most accessible option for all Minnesotans. And you know what? Communities love SHIP. I also wanted to say, people are like, well, where does the funding come from? And when SHIP was started with that health reform law, all of the health reform initiatives were funded under the Minnesota Healthcare Access Fund. And so that's a provider tax that goes onto the healthcare. And so that fund then pays for, all of our work and much, much more work, additional work like our healthcare homes, like our statewide quality and reporting measurement system, and a number of other things. And so again, this is the idea is that people have access to healthcare, and that to really work to contain rapidly accelerating healthcare costs and improving the quality healthcare of Minnesotans. So when we think about SHIP in general, this whole PSC approach, I just want to give, it's a strategy that's designed to create sustainable long-term improvements in our health outcomes by addressing the structural factors that influence health behaviors and access to resources. So unlike traditional interventions that focus on that individual behavior change, so I'll say PSC approach seeks to modify policies, reshape the systems, alter physical or social environments to promote healthier choices and reduce health disparities. So I'll give you a few examples. So for policy change, what do we mean by that? That could be enacting a smoke-free workplace policies. It could be, maybe it's just not workplace. It could be the community. We could be talking about vaping, et cetera. But it's to reduce exposure to either secondhand smoke or exposure to the nicotine. A systems change, what does that mean? That could mean like integrating mental well-being strategies or screenings into routine healthcare visits. And when we talk about environmental change, that could be installing bike lanes or improving walkability to encourage active transportation. And I know our folks will talk more about that. So again, SHIP is not a program. Programs have a beginning, programs have an end. So for example, like a class, you have your first class and you may have 6 sessions and then it ends. That's not what SHIP is. And so we have a little illustration here of how SHIP works, but I'll just call out a couple of things. So when we talk about looking at evidence-based, okay, so it may be evidence-based, but it also may be evidence-informed, because there isn't enough research out there to make sure that, especially in public health, that we don't have as much of the evidence base. So we need, and as we work with other communities, we just need to make sure that it's evidence informed. When we talk about scalability and reach, and we've got community driven, but we also want to scale it. Unlike individual focused interventions, our PSC strategies impact the entire community and lead to widespread and long-lasting health benefits. We think about equity driven. And so addressing social determinants of health, our PSC changes help to reduce health disparities and improve the conditions for historically marginalized communities. We think about cost effectiveness. So preventative structural changes, such as maybe increasing access to healthy foods or implementing workplace wellness policies, they have shown to reduce healthcare costs over time. And then our whole sustainability. So unlike short-term programs, PSC interventions are embedded. They're embedded in laws or institutions or environments, making them more enduring and more impactful. So our work with SHIP is not transactional or just that one-time intervention. We do provide technical assistance and training. We work to strengthen ourselves, all of our partners, in an adaptive capacity to navigate. All of these changes are very complex, and just thinking about PSC can be complex as well. So then rather than a one size fits all approach, we support local public health in working with the organizations and communities in an iterative and contextually tailored strategies. And this process takes time and sustained engagement. So I have when we post the slide, I think we're going to post the slides. There's the link to SHIP. This is where you can take a look at our map. We can give examples of different things that we're working on, and you can take a look at that and all the information. And then the last slide that I'm going to talk about is why results matter. And one of the things that had happened is that in our legislation, we have this results first initiative that the majority of our work needs to be evidence-based. And as you heard me say, things take time. So it's not just, okay, I'm going to do it, and then there's going to be a direct result or a direct impact. We have time, and we have to be able to better articulate how we're bringing it all together. And so what we're doing is we're using, it's called a causal theory of change for evaluating our SHIP work to really create a clear roadmap in understanding how our strategies can then lead to long-term health improvements, and particularly through upstream interventions. Let's see here. And so I'm going to move on because you are just so excited and I'm excited too to hear our presenters, because they're on the ground, they're actually doing the work. And we're going to start with Angie Hasbrook. And she serves as the Population Health Supervisor at Horizon Public Health, where she provides strategic direction and leadership in the development and implementation of innovative public health initiatives. And I'm going to leave it at that. And you can read more about Angie. And then Patrick will be after that. And Patrick is a longtime SHIP person as well. And he's the active living planner with Partnership for Health, and is very, very committed to helping to make communities within his 4-county region more conducive to active transportation. So, for example, biking and walking through improved community design and encouragement of active transportation. And so, with that, you're on, Angie, and just let me know when you want me to advance the slide.
Sounds good. Thank you, Sherry. Yes, as she mentioned, my name is Angie Hasbrook. I'm the Population Health Supervisor for Horizon Public Health. Thanks for having me. I'm excited to share a little bit more about our FoodRx project within SHIP. And so if you want to go to the next slide. I think context always helps a little bit. When we say Horizon, maybe not everyone knows where we're at, but we are a 5-county accredited public health agency in West Central Minnesota. So that includes Douglas, Grant, Polk, Stevens, and Traverse counties. We have all of the traditional public health services, along with a couple that might not be as traditional, like we offer case management and hospice. We have roughly 85 to 90 team members, and we serve around 70,000 residents across our 5 counties. Our biggest city would be Alexandria, and a fun fact, we have the smallest population-wise county in the state being Traverse County. So we've got a nice rural location here. If you want to go to the next slide. One of the things that SHIP really emphasizes, as Sherry mentioned, is being really responsive to the needs of our individual community. And so SHIP really looks at our community health assessment and our works with our community health improvement plan, because our community health improvement plan looks at the specific needs across our 5 counties and then sets those priorities. And we really want to be good stewards of our time with SHIP and our resources. So we are using that data to inform our decisions on what projects that we implement. And so the 3 priorities from our community health improvement plan were access to care, resiliency, and chronic disease. And so we really looked at what we wanted to do, and we thought that Food Rx would not only fit chronic disease, but it would also help within a couple different context areas of SHIP, being working with healthcare and then working within that healthy eating component. You can go ahead and change the slide. So what we set our sights on really collaborating. One thing to note is that we are across 5 counties, and what's unique about us is we have a different largest healthcare system in each of our 5 counties. We have more healthcare systems than just one in each of the 5 counties, but we wanted to have the biggest impact and the biggest reach. So we really set our sights on working with the largest healthcare partner in each of our 5 counties. And we wanted to really look at how are we engaging individuals who are showing up for their primary care annual visits with their physicians or providers. And so we kind of set our sights on implementing 4 different things within our Food Rx project. We really wanted to create standardized screening for social determinants of health. Um, Before you can really implement a Food Rx project, you need to understand, are individuals food secure, food insecure? You wouldn't maybe know that if you're not asking these questions. And so we not only were working with had a goal of working with our healthcare partners to screen for food insecurity, as we're already working with this, how are we screening for some of those other social drivers like transportation and housing and things like that? And so we wanted to set out and create a process where it doesn't just happen sometimes, but it's in the natural clinic workflow. So it systematically happens and you're systematically identifying those at risk so that you can implement strategies to connect them with sustainable food. And so that was the first kind of action plan that we had for our project. The second one was creating clinical community linkages so that once someone has identified as high risk, you're able to connect them with outside community resources. For our focus was food, so we could set up that clinical community linkage referral pathway to like a food shelf for that sustainable food access. That third piece of the project was okay, so we can maybe connect them with long-term support, but it might take a while. How do we really connect them with immediate food support? And so that's where we wanted to launch the start of some nutrition stability boxes, which are boxes of shelf stable food that could go home with the patient at the time of their visit so that it could hold them over for a couple days while they're waiting on that referral for sustainable food access. And then the fourth piece of this is the actual Food Rx program itself, which is a program where a provider can enroll a patient where they receive monthly healthy access to food. And so we felt that it was important to have all of these components in place to have a successful Food Rx project. And we know, of course, with SHIP, we were able to start some pilots and whatnot, but we knew we probably needed some more funding. So we pursued some additional grant funding and were awarded $360,000 through a Prime West community reinvestment grant. And so we'll go to the next slide and I'll talk a little bit about each of these strategies. So I mentioned there was 4 strategies within our Food Rx work plan, and that first was really establishing that standardized screening for food insecurity. And so our healthcare partners that we worked with were Alamere Health in Douglas County, Lake Region Healthcare in Grant County, Glacial Ridge in Polk County, Stevens Community Medical Center in Stevens County, and then Sanford Wheaton. And so one of the neat and unique things is we are working with different healthcare I would say, representatives at each system. Every system has it set up differently. And so being able to start those relationships and have conversations and see how can we get this embedded into the natural workflow so it doesn't, maybe it happens, maybe it doesn't, but it just automatically happens so that we're screening everyone. That was our goal, is how do we make it happen every time so that we can always identify those at risk. And so, as part of those questions, we had two specific food insecurity questions that would flag if someone was food insecure or not. The first one was, within the last 12 months, were you worried that your food would run out before you got the money to buy more? And the second one was, within the last 12 months, the food you bought just didn't last, or you didn't have money to get more. And so, if someone selected as somewhat true or often true, they would be identified as food insecure, and it would trigger some of these other activities to happen after that. If you want to go to the next slide. So before the start of the program, in 2023, we only had one healthcare partner screening some of the time. And so those lines represent the different counties, but the dark blue line is the average across all 5 counties of patients who would be eligible to be screened. And when I say patients who would be eligible, it would be those patients who have those primary care visits. So those annual visits with their primary care provider. And so only 6% of individuals across our 5 counties were getting screened for social determinants of health prior to the start of our project. We started implementing the project over the course of the last year. And then at the end of 2024, that increased to an average of 71% of individuals are now getting screened for social determinants of health. And so by the end, we're hoping our goal is to get this over 90 to 95% within the next year to year and a half. And so we've seen a 64% increase in just a year. So we're really excited about the positive things that we're hearing from our healthcare partners. There's a lot of learning that we're doing, sharing, and so some really great things came from that. First of all, being we're identifying those who might need additional supports. So go ahead and go to the next slide, please. So that first thing, so we start screening. So now what? We don't want to just say, we don't have anything for you. So the implementation of nutrition stability boxes, which is that shelf stable, healthier food options that'll help people get through that immediate need. And so these boxes have things like peanut butter, cans of fruit and vegetables, and it's low sodium, type things, oatmeal, whole wheat pasta, spaghetti sauce, cans of chicken, brown rice. That's what people could expect in a box like this. So anybody that screens positive is offered a box to take home immediately that day. This works because we source these boxes through North Country Food Bank, which is the food bank that serves our region. And we can order through the food bank because we're partnering with all of the food shelves in each of the 5 counties. The shipment gets directly to the food shelf, and then our healthcare partner and the food shelf work together to get those boxes at the healthcare system, at all the clinic sites, so that it can go home with the patient at the time of the screening. And so, again, this is that immediate support that provides a couple of days of food relief. If you want to go to the next slide. And so that third activity out of our 4 kind of pronged approach here is creating that clinical community linkage. Okay, so they have immediate access, but now the goal is how do we connect individuals to sustainable food access? And so we want to improve that referral pathway to community resources. So as part of the project, all healthcare partners signed on to be on the Unite Us platform, which is a closed loop platform, meaning that if a healthcare provider refers to a food shelf over this electronic system, the food shelf can get the patient's information and then let the healthcare provider know if the patient was able to come and actually get food or not. And so that'll help inform the provider next time the patient comes in to know if they actually got the referral that they needed. And so that's what we talk about, this closed loop approach. And so really the things that we're focusing on are the food supports. We have our food shelves on there. We have Meals on Wheels. And so it's really not just about healthcare partners and food shelves, but what are those other nonprofits that can help? I think a step beyond this is then how do we get other community resources on that same platform that maybe work with housing or transportation or whatnot, but that would be kind of a next step. But we do have all 5 food shelves across our 5-county region enrolled and active referrals to date. If you want to go to the next slide. And so all of that helps lead into the actual FoodRx program. And so this is prescribed monthly food from a patient's physician or provider. And it really is a goal. The priority population is for individuals who screen positive for food insecurity and who have a chronic condition. So we want to connect them with consistent access to nutritious food to really improve their overall health outcome. And so we are a rural part of the state, and securing food for this type of healthy food for this type of program was a little bit challenging. You know, we have 5 competing healthcare systems. And now, as part of this project, we were able to start this FoodRx monthly project with 3. Three of them came together to hit some monthly minimums of food order in order to get Fair for All, an organization based out of the Twin Cities, to be able to drive up here with a delivery. It's all on the same day, so they share that kind of delivery, that cost. And that started in August of 2024. And so what that looks like is every month, these patients get boxes of 15 to 20 pounds of fresh produce and about 3 to 4 pounds of lean frozen meat. There's roughly 238 spots across those 3 systems for people to be enrolled. And typically, you would enroll an individual for 1 full calendar year, because we want to measure the things that we're really looking at are BMI, A1C, and then, of course, their food insecurity after the course of 1 year. One thing to note, since August, we've seen some really great feedback, not only from the participants, but from the providers. So we have our 4th healthcare system starting here in March, and then we also have our 5th healthcare system committed to starting in May. So all 5 of our healthcare systems will also be doing the FoodRx program this year, which we're really excited to be able to have them all collaborate and work to not only really impact people to get that healthy, nutritious food, but hopefully have an impact on those chronic conditions, which is a priority area in our CHIP. And so we're really excited about that. Part of this was we wouldn't be able to do this without the strong partnership with our food shelves. So on the delivery day, it's the 4th Wednesday of every month, roughly, and they deliver it during the day, and then in the evening is typically when there's patient pickup of the food. We've worked with a variety of different community partners to be able to deliver for those who have mobility issues. But as you can see, there's a couple of pictures here of our drop site in Glenwood, our drop site in Morris, some of our community partners. And so it's just been a really wonderful thing to see community partners come together to be able to offer something like this. And so we're excited to be able to have that data starting in August, September, October, so we can see those individuals who have been enrolled for a whole year, what those outcomes kind of look like. And so I think if you go to the next slide, that's all I have. And I don't know if we wait for questions at the end, but yeah, thanks for allowing me to share about our project.
Yeah, let's wait till the end and we'll let Patrick talk about his project and then allow for people to think about the questions that they have. So thank you. Okay, Patrick, you're on.
Well, hello, everybody. I'm Patrick Hollister with Partnership for Health. We are the combined public health departments of Becker, Clay, Ottertail, and Wilkin counties, just north of Angie's territory. And we are funded, as is Angie's organization, by a grant from the Minnesota Department of Health, known as SHIP. And today I'm going to talk about 2 projects that I've been involved in to make 2 communities more bicycle and pedestrian friendly. And I really want to encourage everybody on this call to do the same thing, do what I'm doing. Now, some of you work for SHIP, some of you don't, but whether you're a public office holder or you work for SHIP or you don't or whatever, there's some way for you to get involved in a project like this. And If you want to talk with me about your individual community, you're welcome to call me at 218-329-1809, and I'd be happy to talk to you about it. So we'll start with Frazee. Next slide. There's a state trunk highway going through Frazee in Becker County, Minnesota, known as Trunk Highway 87. And I found out back in 2016 that it was due for reconstruction in 2021. And so I talked to the people at Frazee City Hall, and I said, we've got some funding that you could use to do a concept plan for how to make Highway 87 more bicycle and pedestrian friendly. And they thought that sounded like a good idea. So in 2016, we funded a concept plan. And this is a photo that I took at one of our concept plan meetings. And what we finally concluded was, let's put a multi-use path on the west side of Highway 87 through town. West is up on that map. And that's what we ended up doing. Now, the project got delayed by 1 year. So originally it was supposed to happen in 2021. It got delayed to 2022, but we did do it in 2022. So if you go to the next slide. After we had our concept plan defined, which was basically by the end of 2016, the city of Frazee applied for a transportation alternatives grant in January of 2017. Or wait, okay. I think what happened, we ended up applying for that in 2018. So I'm sorry, because it did get delayed for a year. So the Frazee ended up applying for a transportation alternatives grant in January of 2018. They found out in April of 2018 that they got the grant. Congratulations. And so they were ready to go for 2022. They had the funding. So after we had the concept plan established and the engineers did the preliminary design work, we had the gentleman in the wheelchair here who works at MnDOT Central Office. His name is Todd Grugel. He came up with his team, and I don't know what his official job title is, but I think of him as the ADA Compliance Handicap Accessibility Enforcement Officer. He comes up with his team and sort of lays down the law in terms of what the geometry should be. They spent all day, probably about 10 hours, going up and down 87 one fine day. And Todd sort of specified the geometric considerations to make sure that the Highway 87 reconstruction was ADA compliant and handicapped accessible. They were kind enough to let me join on their tour. I stuck with them for about 4 hours. And then I decided to go to lunch and then go back to the office. But they were out there for like, I don't know, 8 to 10 hours, really getting into the nitty-gritty details. If any of you ever have an opportunity to join this type of an ADA tour before construction of a project, I encourage you to do so. It's fascinating. There are so many geometric considerations that go into a project like this. It was very eye-opening. Next slide. So this was the ribbon cutting for the trail. And we did this on International Walk to School Day, which I believe is the first Wednesday in October. So this would be the first Wednesday in October 2022. We had the big ribbon cutting for the new project. Time doesn't allow me to show you a bunch of photos of the project itself, of the end result. But if you look at this photo, you see the gentleman on the far left there holding the end of the ribbon in the black coat and the red shirt. To the left of him is the new multi-use path, the biking and walking trail. Now, it's a concrete trail, so a lot of people think it's just an extra wide sidewalk, but it is for both bikes and pedestrians. Okay, next slide. As long as we're in Frazee, I wanted to mention that I was also invited onto the planning committee for Wanigan Regional Park, just north of Frazee. And so what we did was, since we knew we were having this ribbon cutting for the new multi-use path on Highway 87, after, or I think it was actually immediately before the ribbon cutting, we had an open house tour of the future Wanigan Park in Frazee. And so this is a photo from that tour. And what the kids are holding up there is the concept plan, or was the concept plan at that time for the new Wanigan Park. It's been refined, but I would say fundamentally, it's mostly the same plan as the today as it is in this 2022 photo where you see the kids showing the plan. So if we go to the next slide. Okay, so now we're in Pelican Rapids. So Pelican Rapids, there are two state trunk highways that go through Pelican Rapids. The north-south one is Trunk Highway 59, and the east-west one is Trunk Highway 108. And back in 2018, I got contacted by MnDOT District 4 because Trunk Highways 59 and 108 in Pelican Rapids were not scheduled for reconstruction for many years, but the city went to MnDOT and said, could we do a reconstruction of these two highways early? And the reason why is because we're having line breaks under 59 and 108. In other words, the city was having breaks or ruptures in their sewer and water lines under the highways, and because their own lines were very old, and it was getting too expensive for the city to go in or go down every time and fix them. And so they just wanted to do one grand fix where they replaced the lines. And so it was really the replacement of the sewer and water lines that drove the project. MnDOT said yes. And so they told me in 2018 that they were planning on doing this in 2024. So in 2019, Partnership for Health provided funding to the city of Pelican Rapids, once again, similar to Frazee, to do a concept plan for how to improve the new 59 and 108 for biking and walking and for handicapped accessibility. And so this photo is from our first, or I think our second open house, where we put a committee together. The city hired a consultant. They came up with various options for designs for the new 59 and 108. This was our second open house where we invited the public to come and take a look at all the different options. And we did the old-fashioned thing. They had sticky dots and they put the dots on the options they liked the most. And so that was this meeting. So if you go to the next slide. Later on in the process, because construction was scheduled for 2024, we actually, because it's two highways and because the project was big and complicated, MnDOT decided they were going to reconstruct 59 within city limits in 2024 and reconstruct 108 within city limits in 2025. So this is an aerial photo of, or a drone photo of 59. Before we started reconstruction, we wanted to give the public an idea of what we were planning on doing. So this is a mock demonstration with painted lines and white plastic bollards of bump outs or bulb outs, or what MnDOT likes to call curb extensions, mid-block, where we wanted to make a pedestrian crossing safer. So before we did it with the actual concrete curb and curbs, MnDOT District 4 did a mock-up just to give the public an idea of what the new dimensions would be like, and also to kind of get the drivers used to a narrower space to drive through in that area. Also, we did what's known as a road diet. Previously, we had on 59, we had two 18-foot wide lanes, one in each direction. We narrowed them to 12-foot lanes. And so these white lines show the future width of the 12-foot lane. So that was the other thing that we were kind of forcing drivers to get it accustomed to before the actual project happened. So if you go to the next slide, the big employer in Pelican Rapids is West Central Turkeys. It's a big turkey plant, and the turkey plant was kind enough to let MnDOT District 4 use part of their parking lot one day for a mock roundabout, because part of this project are two new roundabouts. These are what are known as mini roundabouts. They're called mini roundabouts not only because they're smaller in size than a standard roundabout, but also because they're actually designed to be driven over by large vehicles. So West Central Turkeys was kind enough to let us use part of their parking lot for a mock roundabout. MnDOT District 4 set that up, and we invited anyone in town, individuals or organizations with an oversized vehicle, to come test our roundabout in their vehicle. And they did. We got school buses, we got snow plows, we got commercial trucks, we got ag vehicles, we got all kinds of what I call large vehicle constituencies. We even got some people that tow large boats in the summer, and they just wanted to try the roundabout towing their boat. Everybody was welcome. And so if you go to the next slide, here is a Pelican Rapids school bus trying out the roundabout. And then if you go to the next slide, so I'm going to show you before and after drone photos of the project along 59. Now, one caveat here, this is a bona fide, authentic before photo. The after photo is computer simulated. I think by next summer, I will have a genuine after photo, but here is our computer simulated after photo with the new roundabout. Now that roundabout, as I said, is designed so that the center island there can be driven over by large vehicles. But the only vehicles that are allowed to drive over the center island are vehicles that need to drive over the center island in order to navigate the roundabout. I am not allowed to drive over the center island in my Toyota Yaris. So I think if you go to the next slide. So once again, we're Partnership for Health, Becker, Clay, Ottertail, and Wilkin counties. We also did make the sidewalks wider as part of that project, and we did a number of other pedestrian and bicycle improvements that time doesn't allow me to go into. But the bottom line of my sermon here is do stuff like this in your own community. Whatever your role is, whatever your job is, there's an opportunity for you to get involved. And again, if you want to talk to me about how you can make something like this happen in your own community, feel free to give me a call, 218-329-1809. And I'm done. Thank you.
Well, thank you, Patrick. Just as an end on the slides, this is on our website. You can just click anywhere to begin. And it will also have some just ideas and just examples of what our SHIP folks are working on. And then we've got any questions, and I'm going to end the slideshow. I'm going to stop sharing, and let's just give everybody a round of applause to Angie and to Patrick. These were wonderful presentations, or clicks, or whatever we do, little jazz hands, I guess, hearts we've got. So I really appreciate you both taking the time to put something together, really to highlight our wonderful SHIP work. Like I said, communities love SHIP, and there are ways, if you're not part of, not working for the county, there are ways for you to be involved in your local work. And so Ellen, did you want to help me? I
Yeah.
didn't have the
I got 3
chat
from the
up.
chat.
Okay. Yeah.
The first 2 are for Angie. First one, could you share what information food shelves can access about patients through Unite Us?
Yes, so it's going to be a little bit specific to how the healthcare system inputs that data. In order to put data into Unite Us, there has to be consent form first and for all. So the provider or a nurse would ask the patient, would you consent? And they either sign off or they give verbal consent in order to get their information added into that Unite Us online platform. And so each referral entity might be asking for different information, whether it's like an intake form or whatnot. But typically what's sent over is for sure their name, sometimes their address, because food shelves can typically work with individuals, residents of a certain county, contact information so that community resource can reach out to that individual. And then, it just, there's no, I would say, in-depth medical information, unless maybe there's this person is diabetic, would need a diabetic specific food from the food shelf or things like that. But that's really all. You're getting consent from the patient before the patient would ever be sent on the referral through that platform.
Thank you. And next, does your Food RX program plan on being integrated with Medicaid ILOS in lieu of services and settings initiatives?
So right now this program is going to be fully funded through, I think, October of next year. And so we have a full year and a half of full funding. But yes, we are starting to really strategically identify how do we keep this sustainable. That is one option that we're looking at, along with a few others. And so I think that's something that we always want to keep in mind. Even our healthcare partners is like, do we start a program if we don't know if we can sustain it? And so, that's just working together collaboratively with your partners to, make them feel comfortable and confident and let them know that you're going to help continue to find sustainable ways to keep the program going.
Thank you. And the next question is from Matt, who we're all going to see soon, who works for the American Cancer Society, and is noting that what you're doing is reducing cancer risk. And so I was wondering if there are ways that American Cancer Society, the Heart Association, Diabetes Association can more effectively partner with county public health to bring attention to the work that you're doing.
And that would be for either one, right?
Yes.
Oh,
yeah. And probably people in the chat, because there's a lot of people.
Yeah.
So in county health, you're like, I will take up Matt on this. Like,
Yeah.
he has a
It's an open offer, so don't anybody feel like you're on the spot.
He does have his email address, so.
Yeah.
Well, Matt, I'd be happy to talk to you about that. There are a lot of regarding complete streets or making our communities more bicycle and pedestrian safe and accessible. There are all kinds of national organizations that have pitched in to help this movement. American Heart Association, American Lung Association, the American Cancer Society might be involved for all I know, but and there are other national organizations like the Smart Growth Alliance and the National Complete Streets Coalition. This isn't just Minnesota doing this. This isn't just SHIP doing this. There are people doing what I showed you all across the country. And there's lots of ways to get involved. So
if you can help us find the fact sheets on your local projects, we can get them in the hands of our local volunteers.
Oh, that would be fabulous.
So happy to connect with you offline, Patrick, and other people on the call.
Yeah. To Ellen and Mary, send me Matt's contact information after the call, and yours too, by the way. So
Can do. Do we have time, Matt, for one more question?
Absolutely.
Okay. How long did it take to get all of this started? To build partnerships, get healthcare partners, other partners on board. Because I assume it's a lot of work. How long did it take?
That question was for me.
For
I
either of
think
you.
for
Angie, go,
both.
Angie,
Yeah.
go for it.
Okay. I started with SHIP about 2.5 years ago. I moved to the community, and so this was a project that I had a little bit of experience in a previous community. And so I would say it really started with relationship building, introducing myself, talking about some background that I had, but also looking at how we bring different community partners together. And so I would say over the course of about a year and a half, we were able to get things moving. And then we really hit the ground running in 2024. So yeah, about a year and a half to 2 years.
I would say in my case that, I'm one of the long timers or old timers for SHIP. I've been in this since February of 2010. And I won't tell the whole story, but I first got involved in this in 2011 because I got an email from somebody asking me to help them with this in Battle Lake. And I really had to learn as I went. In 2011, I was pretty clueless about how MnDOT works, the right time to get involved in each of these projects, who I need to talk to. And now, 14 years later, I know a lot more. And if you're in Minnesota, I can probably give you some advice. Each state works differently, but I feel pretty confident about how this kind of process works in Minnesota now. So again, 218-329-1809, give me a call. I'll help you out.
Thank you all. You go, Shirley, and then we'll just pass it to Matt.
No, I was just gonna say again, thank you. Thank you. Love our relationship. And thank you MPHA for hosting this webinar. Much appreciated to Mary and Matt and Ellen. And I'm gonna turn it over to you, Ellen and Matt. Oh, Ellen, you're on mute.
Well, on purpose, because I'm talking to myself.
Oh.
All right, Matt, take it away.
Well, really want to thank our presenters today and everybody that joined. Great information about local efforts that are making a significant difference in public health. If you're interested in learning more about other ways to help improve public health, wanted to make sure to point out that the MPHA annual conference will be in Duluth this year, May 15th and 16th. Registration will be opening soon. The theme is Resilient Communities, Advancing Health Equity Through Collective Action, Policy, and Partnership. So please check that out. Look for an email in your box soon. Next, is there another slide, Ellen? Yes.
Yes, yeah.
SHIP attendees, people that are not members of this call, and there were an awful lot that signed up both for the live call and the recording. Really appreciate you joining us today. And we want to offer you a 10% discount off our $50 membership. I got the price right there, Ellen, didn't I?
It is $60.
$60 membership, sorry. So 10% off, $6 off if you sign up in the next week. But that membership comes with another benefit, which is cheaper registration for the conference that I just so it's a twofer. Two things, part of our commercial. And then one other thing I wanted to toss in that was not part of this. SHIP is state funded. And as everybody knows, budgets are getting harder. There's been a lot of hand wringing about what's going to happen with federal funding. I think we should be proactive about programs like SHIP and maybe reach out and share information about these great local programs with our local elected officials. So keep your eyes on your email box. It could be both members and non-members. Get an email very soon encouraging you to reach out to your local elected officials. So thank you everybody for joining our call today. Really appreciate your time and everything that you do to make Minnesota a healthier state. Thanks everyone and have a great day.
Thank you. And this ends the webinar.